Well, today kicks off a month of action to urge more Americans to get the COVID-19 vaccine. President Biden is hoping 70% of our population will be vaccinated by the 4th of July and has launched a big push to make that happen. And we are clearing up some confusion for those still deciding whether or not to get vaccinated and getting answers on some of the CDC's most frequently asked questions.
And joining us now is Dr. Victor Waters, Chief Medical Officer with Dignity Health St. Bernardine Medical Center. Doctor, thank you for joining us.
Thank you.
All right, let's start with one of the most common questions. COVID vaccines at this point, they're considered experimental, hasn't been fully approved. Are they safe?
The short answer, absolutely safe. And you can see with almost 50% of folks getting vaccinated that there's not many adverse. There's the typical side effects, local arm soreness, maybe fatigue, low fever, but it is a safe vaccine, and that includes all of them.
Doctor, some wonder if someone has already had COVID-19 in the past, why would they need to then get the vaccine?
And the reason is because the immunity is not prolonged. The antibodies that is produced as a result of infection isn't a prolonged protection. So that means any time between 6 to 8 weeks out of the person being infected, that antibody will go down. So that's the need for vaccination.
All right, what about children?
Children is very important. You know, we hear that they're not admitted, they don't have as many side effects, many complications from acquiring COVID, but I can tell you they're still at risk for getting COVID and spreading COVID. So it's important, as well as the logistics of getting back to school, traveling with the families, members who are vaccinated. It's critically important for the adolescents that are getting it and those under 12, soon to be, get vaccinated later on.
And Doctor, one topic that's been a little bit of a concern for women who are pregnant, what's your opinion on that?
Yeah, you know, the messenger RNA, that type of vaccine, Pfizer and Moderna, really there's been no evidence that there's been any kind of complications or risk to the pregnant mom. But what I always suggest is that they have a discussion with their obstetrician and discuss the risk, benefits, and potential alternatives. There's not really many, but I think under their risk, the risk that they may have for acquiring COVID, morbidities, hypertension, diabetes, all those things they need to be taken into account.
All right, what about those with underlying conditions? There has been reports of people that, younger people that had some heart conditions, that there were some problems for them.
Yeah, there was an some early indication that might be some side effects for some young people, actually teenagers, and that's been followed closely. It's not direct link to the vaccine yet, meaning those children that acquired the myocarditis, we call it an inflammation. First of all, they may have been admitted, some of them. They may have required some treatment, but most have been able to be released and safe. That's good news. The other fact is it's not clearly proven yet that it's associated with the vaccine. You have a certain number of people getting vaccinated, and some may acquire some complications, but you still need to compare it with the same population, same age as those, and the risk of acquiring any type of other conditions like myocarditis. So at this point, the vaccine, I can't stress enough, is safe for children.
And Doctor, we don't know the 100% on this, but how long are the vaccine protections lasting as of now?
Yeah, you know, people aren't clear on the term, the amount of protection you'll get in terms of the length of the months. Certainly, there is discussion of getting the vaccine, a booster in the fall, and that's going to be a challenge because different populations like healthcare workers and the older population may have started getting vaccinated, as you know, sooner or earlier, and then you'll have a later, as we progressed in the strategy of immunizations, more people got vaccinated, younger people got vaccinated. So how we strategize that for a potential booster all comes into, well, what's the length of time that the initial vaccine, completed vaccine, will protect us. You know, and that's more to come on that.
All right, Dr. Waters, thank you for joining us, and I'll be interested to see the data down the road.
All right,
Yeah,
thank you so
thank you.
much. Appreciate it.